Hello everyone and welcome to another case in the series of how to manage different cases in pregnancy. Today we will be talking about how to treat chronic hypertension in pregnancy. So let us start the case. A pregnant patient came to your ward, or she's in OPD, and she presented with asymptomatic high BP, or she has any symptoms like headache, fatigue, dizziness. So she can be symptomatic or she can be asymptomatic. So how can you define chronic hypertension in pregnancy? Systolic BP of more than 140 mmHg or diastolic BP of more than 90 mmHg is the cutoff point for diagnosing the hypertension in pregnancy. But remember, chronic hypertension means the patient prior to her pregnancy she had high BP, and she was diagnosed before 20 week of gestation. That is typical definition. And if the patient developed hypertension and it persisted longer than 12 weeks after delivery, it is defined as chronic hypertension. So this is one of the definition for chronic hypertension. Then the another is gestational hypertension. In gestational hypertension, the blood pressure will be greater than the same measurement but on two separate occasions and at least 4 hours apart after 20 weeks of pregnancy. So here before 20 weeks of pregnancy, and here is after 20 weeks of pregnancy. So if it's after, it is gestational. If it is before, it is chronic hypertension. And the most important, when previous blood pressures were normal. So remember these two cutoff points for the definition of chronic hypertension and gestational hypertension. So here is a flow chart in which the hypertensive disorders in pregnancy. If it is less than 20 weeks of gestation, it is known as chronic hypertension. If it is more than 20 weeks of gestation, is known as, it can be divided into preeclampsia, eclampsia. We'll be talking sooner in another lectures about it, gestational hypertension and chronic hypertension with superimposed preeclampsia. So remember this gestational weeks on which you will be separating the different differentials. So our case, as we are discussing chronic hypertension, so we'll be dealing about the chronic hypertension, diagnosis of chronic hypertension. First of all, lifestyle modifications are most important. Sodium restrictions, smoking and alcohol cessation is most important even for the fetal growth, because if she's smoking and consuming alcohol, it can lead to intrauterine fetal retardation, damage, and certain fetal anomalies. Then the diet should be including a lot of fruits and vegetables. Remember, the dieting and weight loss are not advised in pregnancy, even she is obese, because she got pregnant and she need to provide nutrients for the fetus. So the most important discussion, we'll be talking about the safe anti-hypertensive medications which are used in pregnancy. Labetalol, alpha-methyl-dopa, nifedipine, and hydralazine. These are the safest drugs to be used during pregnancy. So kindly remember it. Next, so the management, the doses are different, so you can select any one of the medication, but depending on the institution, if you're going to select alpha-methyl-dopa to 50 mg, you can give in TDS or QID 4 times a day and maximum dose of 2000 mg per day. Or you can give tablet labetalol with the starting dose of 100 mg per oral BID. The maintenance dose should be between 200 to 400 mg BID per oral, and the maximum dose is 2400 milligram per day. And it can be used as monotherapy or it can be combined with hydralazine. So the labetalol can be combined with hydralazine for the management of hypertension if it is not managed by labetalol. The next one is long-acting nifedipine can be added if the BP is not controlled with labetalol or alpha-methyl dopa. So if it's not controlled, we can add nifedipine, the third agent, for the management of hypertension. So nifedipine 30 mg initial dose can be used safely, or 20 mg BD/TDS. Dose can be increased to 60 mg daily if adequate response is not seen in 7 days. So if you are using nifedipine as your first choice, you need to monitor in the first 7 days if it's adequately controlled or not. So remember, monitoring the patient ward, if he's in the ward, is most important, that the BB can deteriorate and lead to complications. For the guidelines, remember always follow the new guidelines, and these lectures which I'm uploading, please, it's just for the educational purposes. Always seek healthcare professional advice. So thank you for watching. Please like and subscribe my channel and comment what future lectures you required, and I will try to make that lectures for you. Thank you for your watching.